Welcome. I'm Libby Doggett, and I'm here at the LBJ School at the University of Texas in Austin with my friend Cynthia Osborne. I'm delighted to be here. I'm delighted to join you today. For those of you who don't know my background, I've worked in all aspects of early education. I've worked in childcare, Head Start, and schools with kids with disabilities and kids without. I've worked at the federal, the state, and the national level. I've worked in pre-K, home visiting, early intervention, and systems building. My most recent job was actually in Washington, D.C., heading up the Race to the Top Early Learning Challenge grants and the preschool development grants for the former administration, along with my colleagues at HHS. But I'm delighted to be home and actually back to my roots in early education. So, Cynthia, one of the things I really love about you and admire is that you do research for children and families, but you also really engage with the community and with policy leaders. You want to see how things are working out on the ground. So tell us, how did you end up doing research in the first place?
Well, thanks, Libby. I really appreciate that we're able to have this conversation. And I know you introduced yourself, but it's such an understatement for the role that you've played in really moving us forward in home visiting and pre-K and in just early learning throughout. So thank you for what you've done. And I've been inspired by people like you. I came through this in somewhat of a winding path. I, after college, was working as an economic consultant, but I kept having these nagging questions of why it is that some kids seem to succeed with little effort and other folks are struggling so hard. And I really wanted to figure out that puzzle. That wasn't my background. I hadn't understood what the research said or what the experiences were. I had come from a very modest income working class family. I didn't understand all these sorts of pathways. And I was pretty sure that it was the education system that was the answer for it all. That was where I was able to kind of break away and learn things that I hadn't been exposed to before. And I thought, well, that's what we need. We just need to make sure that all kids have a really high quality education and a great teacher. So I entered into the field of education. I got my master's in education, and I taught for several years, mostly in sixth grade in a low-income school in California. And pretty much my second day on the job, I realized it's not just the schools that are the answer. They're a really big part of it. But there was a lot going on in my kids' lives that were affecting their ability to really engage with their school day, whether it was a family member moving in or out, someone returning back from being incarcerated. There were murders or other sorts of criminal activity going on in neighborhoods. And these were kids who really wanted to be there, but there were things that were making it difficult for them. And I decided I wanted to learn more about that. I wanted to understand how the neighborhood, how communities, and how policies actually affect our families, and to better understand the role that families play. And so after teaching for about 4 or 5 years, I decided to pursue my master's in public policy. And I went to Harvard. This was in the mid-90s or the late 90s, right after welfare reform. And the folks who had been in the administration who left in protest over signing the welfare reform bill in '96 were back there, and I wanted to learn from them. I wanted to understand policy. I wanted to understand poverty and inequality. And while I was there, I became more and more interested in the role that the family plays and how all of this intersects. And so I was given the opportunity to study with Sarah McClanahan at Princeton, and to really explore there the role that policy, families, neighborhood, communities all intersect to strengthen the system of care that we provide for our families and the family's ability to be able to do what they want to do. I've been in Texas now for almost 15 years here at the LBJ School, and I really enjoy the opportunity to work closely with our state agencies as they're trying to implement innovative policies to strengthen families and children, as well as folks on the ground in our community. And I think that that's something really important for my research is that it's connected to the folks who we're actually trying to serve, and that I listen to those voices, and that's infused back in what I'm doing.
So that's how we got connected.
That's how we got
connected. I was in
connected.
Washington, you connected with me. So Cynthia, since I was a bilingual first grade teacher many years ago, and since I got my PhD in early childhood special education, also many years ago, lots has changed.
Yeah.
What are some of the major changes that have happened in the research?
Yeah, I mean, what has evolved over the last 20 or 30 years is really remarkable. I remember back in 2000 when the book Neurons to Neighborhoods came out. And that was the real first time that the field of early childhood grappled with this question of whether it is nature or whether it is nurture that really affects our growth and development. And it was those scholars who came together and said, it's not one or the other. We understand now how it's nature via nurture, and how what we're born with is impacted by the community and environment in which we live. And subsequent to that, we've also just had such a stronger understanding of what's going on in our brain science. It has been an incredible expansion of knowledge to really understand what's going on inside our brains, how they develop, and how poverty and adversity literally get under our skin. And we're learning more now that it's not just about the brain, it's the immune system, the metabolic system. Our whole body is affected by early adversity in ways that we just didn't fully understand when we were both being trained. Our developmental psychologists have been telling us forever that it is about attachment. It is about early relationships. That's not new information, but we're understanding really how that, when in the absence of that, it's really affecting our epigenetics, our brain development, our responses to stress, our cortisol levels. And this sort of development in the brain science, I think, has really convinced folks that we need to act. We have to intervene in the earliest stages of development. It's happening prenatally. It happens in the first year, in the first 24 months. Every part of that is really a sensitive period for the developing brain. I know that folks are convinced now more and more that we have to do something, or that they know about this brain science. I hear that all the time. And I think that that's so crucial. You don't have to know that what myelination is or what a telomere is to really understand that this is a period of really crucial growth in the developing child, and we have to figure out more and more how to support families and children during that period.
So that actually leads to my next question. So research certainly helped move the pre-K agenda.
Yep.
It's helped move the home visiting agenda. But sometimes I find policy leaders who say, I don't really believe this research, or they have conflicting research. How is this new Policy Impact Center going to be different, and what are you striving to do with it?
Well, what we want to be at the new Prenatal-to-Three Policy Impact Center is a resource for states as they develop and implement policies to really strengthen the prenatal-to-three period. We want to try to bring the science of the developing child to policy, to life. We know that we have to intervene, but we want to try to provide guidance to states about what it is that they could do to be most effective. Right. We're doing a couple of different things in this vein. Right now, my team is busy at work, and we're reviewing all the evidence of what we know and what we don't know when it comes to policies that impact the prenatal-to-three period. And we're looking across a wide range of things, from areas that affect maternal and child health, that allow parents the skills and knowledge and resources that they need to be the parents that they want to be. And when our kids are not with us, that they're in high quality learning environments. So we are covering a range of policies that we're doing these comprehensive reviews on, so that we really understand what we know and what we don't. The second thing, in the way that we want to be a resource, is that we're building strong relationships with leaders at the state level who are in the prenatal-to-three space. We really want to understand what they're doing, what their goals are, and what their challenges are. States have so much to learn from one another, and the more that we can share that information so that they can build on what each other is doing, learn from one another's mistakes, copy one another when it makes sense, this will really strengthen the field. But we also want to take that on-the-ground experience and infuse it back into the research. We want to make sure that the research that we're producing, not just me, but the academy writ large, is really infused with the voices of the field, that it's useful and relevant and that it can be acted upon. We're hoping through all of this that we will be able to develop a discrete list of policies that we could really stand behind and say, here are the policies that we know now have the strongest evidence base. And if you're going to invest, here's ways that you might invest if you want to make sure that that you'll get an effective return. And we want to measure the state's progress toward this to see how they're doing over time so that they can see the growth that they've had, and they can compare themselves to other states so that they can see who they could learn from. We'll track what they're doing with regard to the policies, how well they're being implemented, and whether they're seeing the outcomes that we would expect to see when they do implement those policies.
Well, certainly having an effective research and having a clear policy goal helped pre-K.
Yeah.
So what does it really mean for a policy to be effective, to really work? What's the standard we're going to use?
Well, that's a really important question, and it's not as simple as I wish that it were. First of all, when we're looking at infants and toddlers, the level of research and evidence that we have is not quite as robust as what we have on our pre-Kers. Right. We know a lot more about our 3, 4, and 5-year-olds than we do about our littles. And so the first charge is really to understand what we know, where we have taken studies that have tried to have a causal link between a program or a policy and impacts on kids that are not just helping us to understand the nature of the problem or in anecdote, but that are really using as rigorous of techniques as possible so that we could really understand whether it works or not. But that's really not enough. Whether something works or not is really an important question, but we want to expand on that and be a little bit broader. First, we want to know whether it works for everyone, or whether it's only been tested to work on a small group of folks, or whether we have actually included in our studies those who are going to be impacted the most about these policies. We want to see if they're closing the gaps. We don't want to make it so that we change a policy and it only improves, say, middle-class white kids, but it doesn't help us with those who are even in more vulnerable situations. And so we want to pay attention to whether the policies are closing the gaps. We want to know how big of an impact it is. In statistics, we can find things that are statistically significant, which is meaningful, but they may not be substantially different in the before and after. So how big of an impact? How many kids are impacted, or is it making a big difference on a really important, small, vulnerable group of kids? We want to look at the cost and the return on investment and whether we know investing early has long-term payoffs, but we want to be able to demonstrate that. Policymakers have to use scarce dollars to make hard decisions, and so they need information about how much it's going to cost and when they can expect to see returns.
We certainly get asked that a lot.
Right, it's a crucial question, and we can't leave that off of the equation. So we want to look more broadly than just whether something kind of worked in an experiment or didn't. We want to see that it's been replicated. We want to see that, especially if it's a program, which is a little different than a policy, that the implementation of it is somewhat clear enough that we could do it and we could get the same effects that we got when we did it in more of a controlled setting. We know that that's been an issue with a lot of the programs that we have, that implementing them on a large-scale basis gets very difficult to do. So we want to look at the ease of implementation. And when we're looking at a policy, states have such a wide range of policies. If you take something like a state earned income tax credit, There are some states in
We
which
dream about those in Texas.
we don't have an income tax, so it's hard to have an income tax, earned income tax credit. But for a lot of states, what they do is they take a portion of the federal earned income tax credit and they give that to their citizens. And those folks, sometimes it's refundable, sometimes it's not. Sometimes it's more than half of the federal amount, sometimes it's only less than 10%. So there's a wide range of what's going on out there. And we want to be able to help point to the ones that are the most effective, getting the biggest impact. That if you're going to put money up, let's make sure that it's really worth it and that it's going to get the results that you are intended.
Great. So what are your major concerns, actually, about saying that policies are effective?
Well,
it's hard.
It's hard. It is. I am concerned that we don't have enough information about everything that we're currently doing or that we aspire to do. And I don't want to send a message that we shouldn't try things, that we shouldn't be innovative, simply because we don't know yet. We want states to try. But what we want to do is to try to provide as much guidance to them about the level of risk that they're actually going to be taking. When we look at how many different places have tried it and give them the honest results that it seems promising or has a very strong theory of change, but they're probably going to have to take some risks. We definitely don't want to send the message that we don't know that anything or that nothing works, because we know that policies, when we target them for our little ones, that they actually make a really big difference. And the absence of policies, we've seen that when we've taken money away or taken funding away for certain things, that actually makes a really big difference. But the challenge is providing the best information that we can with the level of nuance that policymakers and state leaders need, but that's honest and accurate and comprehensive, but that sends a message that we need to be innovative and continue to try things and evaluate things without sending a message that we just don't know what to do.
Yeah. Well, some of the research that I've seen is not that helpful for policy leaders or even advocates who are trying to get more money.
Yeah.
So, how will you help us and policy leaders understand the implementation challenges that you just spoke about?
Yeah, and I think that research can be not very useful for a couple of reasons. One is that we often don't understand these implementation challenges like you're suggesting, that we will just give you the main effect, the policy worked or it didn't work,
right,
but we won't help you to understand why or why not, so that we really see, is it that the policy itself wasn't done well, it wasn't funded to the level it needed to be, the training wasn't sufficient, the folks didn't know about it or how to get, if they were eligible, how to get on it. Those are the types of things that we want to try to unpack and get inside of to really understand what's inside that black box of the policy. What is it about it that's really working and what is not? And that's a responsibility that we as researchers have, but we don't always do as well as we should. The other thing that we do is we talk in a language that really isn't accessible to a lot of folks. I love things about regression, discontinuity designs, and difference, right? I love all of that. But that doesn't help. That's not what folks on the ground need to know. They need to have a reliable source of information that they can turn to and a trust that we have looked into that. We are telling you if we believe a study is rigorous, that it is rigorous for these reasons, and we will document that and put that on the table for anyone to double check our work and to make sure that they agree with our conclusions as well. I'll tell you about the process that we're using for that as well. But at the end of the day, we need to just help folks to understand this policy is effective for these groups. This is the type of outcome that you should see. These are the implementation challenges that might need to be taken into consideration. Be very clear and deal with the nuance in a way that doesn't detract from people's ability to use that information.
So give us a hint. What are some of the policies that you're coming up with that you're finding are really effective?
I wish I had all the answers for you, and I can tell you the process that we're using, and I don't have all the answers right now, for sure. Like I said, we are looking in these three broad areas of maternal and child health, or making sure that kids are born healthy and get off to a healthy start. We're looking in the area of parenting and family support so that parents have the skills and knowledge that they need to take care of their kids, as well as the resources, income, employment, housing, food, that they need to be able to provide the type of environment that they want for their children. And then we're also looking in policies that are related to early learning environments, whether it is subsidy rates or ratios or training and compensation, methods to make it so that these are high quality, safe environments for our littlest infant and toddlers. Those are the types of policies that we're reviewing. We have about 30 that are on our list of going through, and we're making headway as we're moving through to determine whether there is, what the evidence actually says. The way that, first of all, that we're getting this information about which policies to review is not a mystery or a secret, and anyone who's watching this should feel free to contact me and let me know of policies that they're interested in reviewing or having us review. But the way that we're doing it is we're reviewing what states are currently doing. We're talking to all of the experts in the field that will talk to us. We are looking in the literatures. We're really doing as broad of a landscape as we can to see what's out there, what are we trying, what are we implementing, so that then we can take that and say, what does the evidence say for each of those? We start very broad. We read everything that's been written about that policy. Then we try to suss out those that are trying to make that causal link, like I said, and really dig deep into those studies so that we understand whether it was a big sample, whether the results could be generalized, and so forth. And then we are having a team discussion where we're trying to really kind of battle with some of those conflicting findings that one study will see that it works, another will show that it didn't work. What do we know about this study versus that one? How do we weigh that evidence? We are then sharing this information with a group here at UT who are experts in the early childhood field, and we're reviewing the evidence together. We will be going through a formal peer-reviewed process ultimately, but we are also relying on our National Advisory Committee or Council that is made up of experts who are both academic, federal, state leaders who have run agencies, who have been in positions of state legislatures. We rely on them to also push back, question us. What about these conclusions do they have any sort of concerns with? So every policy is going through that sort of scrutiny so that when, at the end of the day, when we're saying, here's a policy that we could stand firmly behind, we think it has sufficient evidence, it has looked at the whole landscape of people, not just one group, that it is, we understand what the costs are. It may not be cheap, but we understand what the costs are. When we get a list of policies that have all of those elements, then we're hoping to be able to share that. Well, our plan is to share that with states so that they would have that information. Things that we're looking at now are things like paid family leave and earned income tax credit at the state level, the subsidies amounts in child care, methods that states are utilizing to try to reduce maternal mortality and morbidity. It's a wide range of policies that we're looking at, but we don't begin with any conclusions. That will come after a review of the evidence.
That's good to know. So, fortunately, the early childhood field is getting actually a little bit crowded.
Yes.
There's lots going on. How will this Policy Impact Center really be different?
That's an important question. And like you said, this is a space that has so many incredible folks working in it. And some are working in the prenatal-to-3, some are 0 to 3, some are 0 to 5. But we're all trying to really focus on making sure that kids get off to a healthy start, because we know that that's what's important for future health and well-being.
Right.
And the way that we're hoping to make a contribution is, one, to recognize the other work that's being done and to build on that as much as we possibly can. That we want to be a resource for them as well. When we're talking to states or we're doing any sort of reviews of policies that they're focused on, we will share that information as much as, as they will take it. We really want to be in the center not in the center, we want to be the place that helps to exchange information among all those folks who are really doing this great work. What's a little bit different about us is that we are in an academic institution. I'm not an advocate. I care very strongly about the same goals that many of our advocates
You're just
have.
friends with advocates.
I'm very good friends with advocates. But we want to be the resource for them as they're making their case. We want to be the resource for state policy leaders. We want to be this clearinghouse for policies, if you will, in the way that we turn to some of our clearinghouses for programs about whether those programs have demonstrated that they're effective and can be replicated. We want to be that trusted source that folks can turn to for information about policies. And we're working closely with some of the other folks in this space so that we can make sure that we're not duplicating efforts, that we can complement what they're doing and build on that. We don't want it to be confusing for the states in any way. We don't want to come out and say one thing and have another group come out and say something different. So we want to make sure that we are having conversations and partnerships with the folks in this space that, again, will advance the field and not add to confusion in any way. I think that one of the things that has been missing is that this real breakdown of what we know and what we don't know with regard to policies. That folks have a lot of information about what the problem is, and we have experts like at the Center for the Developing Child who have been shouting this to anyone who will listen about how important it is that we incorporate the science of the developing child into policy and practice. We have other advocates who have been really working closely with states to help build their capacity to make change. And what we want to do is to bring this information about which policies are more effective and which ones don't have the evidence base yet, so that as folks are making these tough choices, that they would have that information. And I think that's how we're going to be different.
That's going to be fantastic. So what's your timeline? What should we expect to see in the first year?
Well, we would like to have it all done right now, but that's not as realistic as I would like. We're hoping by the end of this calendar year that we will be able to have at least a first list of policies that we could say, here's what we stand behind. Our National Advisory Council will be meeting in November. That's when we're going to be having some of these discussions and really review all the work that's being done to date. And then the most important thing is that we build these relationships with states. We do not want to come out from on high and say, here's what you should do. We want to come out with evidence and put it on the table and talk to people about how it can be useful for them and what would be more useful or different, so that there's buy-in, that they see themselves in this, that we really learn what they're doing, what their struggles are. We want to gather data from the states without burdening them, because we know that states are being asked by a lot of folks for different sorts of data. So we want to make sure that we have accurate, up-to-date information without adding additional burden, but we'll be working all through the winter and into the spring to build these relationships with states and find out what their response to these policies are. And then our plan is a year from now to be able to host a State of the Field meeting where we come together and we share what we know about what states are doing with regard to policies and what we know with regard to these policies and what we need to know, so that we can try to advance our understanding and push it forward. But that's our plan for the first year. Is this time next year, you and I will be at our first conference.
That will be quite exciting.
It'll be very exciting.
So I'm delighted we had this time to talk about this. You know that we will all be watching, because I think people are very concerned and interested in what you're doing. Certainly I stand ready to help, and I'm sure that all the people that view this are ready to help as well.
I am really excited to be in this space and working with you and with all the other folks. And what I do is really welcome folks to send information to our Policy Impact Center, contact me directly. We want to be a resource, and we want to learn from everyone about what they're doing and how we can actually help with that. So definitely a conversation that is going to be ongoing.
Great. So thank you, Cynthia. We really appreciate your time.
Thanks, Libby.